Tony Vasquez, and today I'm representing Dr. Raul Vasquez, my husband, and G Health Enterprises, which includes, of course, Urban Family Practice and G-Bond. We are here today to announce a great collaboration that we have enacted with a great Buffalo Bill player, Zack Moss. So, yeah. So I haven't had an opportunity to know Zack for very long, but on the limited interactions that we've had, I learned a little bit about him and his significant other, Jess. They have come from very humble beginnings, very much like Raul and I. So I'm born and raised in Buffalo, New York, Raul from the South Bronx, and I understand Zack is from Miami, Florida, and Jess is from Utah. And they came from places of similar to our communities in Buffalo, and they're here to help those communities because it reminds them of home, it reminds them of where they came from, and changes that they want to make. So, you know, G-Bond is all about, we have been all about changing our communities for the better, empowering them in ways that they never thought could come true. We want to be able to see ourselves in them and see them in ourselves. So, you know, Zack said that he wants to not only be an influential athlete, but an influential person of the community. So we welcome that in our community, and that's what we do. That's what we've always done, and that's what we would continue to do. You know, Martin Luther King said, a great leader is not a seeker of consensus, but a molder of consensus. So we want to mold our community to be the best that it can be. We want to look out into our community and see great, not only athletes, but doctors and lawyers and teachers and police officers and firefighters. We want them to be the best that they can be in whatever profession they choose. But in order to do that, we have to empower each other. And we are here today with Dr. Daniels, who is our pediatrician here at Urban Family Practice on our Jefferson site. We're here with Zack Moss and a bunch of other fans of G-Bond and fans of the Buffalo Bills. So without further ado, I'd like to introduce you to Mr. Zack Moss. Thank you.
I don't really know how to, catch up to that speech. That was a great one. Thank you guys for, having me and giving me this opportunity to, do something in the community. Like you said, I'm from Miami, Florida. I come from lower income community, and to see what G-Bond is doing in this community, only being here in Buffalo now for my second year, but to see what they've been doing in this community, it was a no-brainer for me to try and get attached to this. I just wish, growing up in Miami, I wish that, I had this. I wish some of the kids, growing up there right now had this. I just wanted to be attached to this because I think what they're doing here is super, super special. And like you said, I'm all about, being more than an athlete and trying to do more and finding different ways to use what God gave me as a blessing to be a football player, but do more than that. And that's exactly what I believe that G-Bond is doing, and I'm super grateful to have this opportunity to work with you guys. Thank you.
Well, good evening, and many of you know I'm not a man of a lot of words, but in the evening and in a time in our country where athletes are told to just run the ball, to just dribble, to just shoot, it is refreshing when it's all said and done to have an athlete that cares more about other things other than what's on the field. And I think we have that with Zack, and I'm certainly looking forward to having Zack be part of Urban Family Practice, looking forward to his influence, not only now when he's in his playing careers, but certainly when the cleats go up and you look back and you evaluate yourself and say, job well done. So that's what we want in a community that's, riddled with social determinants of health. Our job is to tackle these, no pun intended. Our job is to address them. Our job is to call out injustice where we can and do what's right for our community. So with the help of Zack and certainly the Urban family, I'm sure we can do that. So thank you.
Is there any questions from the media?
Can you just kind of go over what you do here and why it is that you do it?
So what we do here is we try to give our families everything that they need. And that doesn't necessarily mean just the medicine. The medicine is critically important. But a lot of our community need other things. They actually need kind of things as it relates to, as I alluded to, the social determinants of health. So as it relates to transportation, as it relates to food inequities, as it relates to food deserts. So all of those things are what G Health is really about. It's about kind of giving us a playing field that we can help those that, besides kind of going into our exam rooms and giving them the great medicine that they deserve, but also help tackling some of those other issues. So that's what it's about.
Can you talk about the need and why this place needs to exist?
Well, you know, the need in our community, and I think what you've seen, and certainly for people of color, we know COVID has always kind of shown inequities. But I think what COVID has done for those that may not be aware of is shine the light on those inequities. And so if you think about kind of the people that are affected the most, it's going to be those that have comorbid issues, those that have underlying conditions. And G Health and certainly Urban Family Practice, our role is to help dismantle, help chip away all of those different things that will allow our families and our generations after us to come and be healthy and thrive. And that's what it's all about.
Talk about the partnership with Zack. What do you hope that does for you?
Well, you know what? I hope Zack is just the seed. You know, I always talk in terms of, you know, you plant a seed, and before you know it, you have an orchard. And my hope is that Zack will get in the locker room and talk to other of his teammates, and they will come on board. Because there's strength. You know, we're always greater than our individual parts, but together we can start doing something. And I always like to use the word transformative, and I think that's what we're trying to do. We're trying to do something transformative for our patients and our families. So my hope is that we'll get more members of not only the Buffalo Bills, the Sabres, but I think it's really vitally important that we're a voice for the community, so we're not the forgotten people in the city.
And Zack, could you talk a little bit about specifically what your part of the partnership will be? What it'll look like, what you expect, what you want it to be?
I mean, for me, I just, you know, want my part to be, like you said, a seed, you know, to get in the locker room and be able to speak to guys and kind of let them know, you know, what's going on with G-Bond and what they're doing in the community. And, you know, it's a lot of guys on the team that, you know, have a huge heart and come from, you know, a lot of the same communities like this one. So, you know, like you said, just want to be a seed, just want to be somebody that, you know, when people turn on the games, they think about G-Bond and what we're doing and things like that.
And you're not from Buffalo.
Correct.
And I know it sounds like a callous question, but it's just to get you to force you to answer. But like, why do you care about people in Buffalo if you're not from here?
I mean, I think you don't have to be from somewhere to care about people. I think just caring about people is just having a huge heart and just being a genuine person, honestly. So it doesn't matter if I was in, you know, California or in Miami and things like that. You know, wherever I was going, I wanted to do something in the community. And thankfully, G-Bond has allowed me to do that.
And you talk about being from a similar situation in Miami. Is kind of similar to this neighborhood, I'm assuming?
Yeah, I'm from Liberty City in Miami-Dade County. It's not the nicest and not the easiest place to come up out of. And, you know, I'm one of few that has been able to make it to this level. And, you know, I always told myself, like I said earlier, just to want to be able to do something and give back to people. Like I said, God gave me a huge blessing, and I want to just use that as long as I can and impact as many people as I can to, you know, allow kids, you know, even adults to, you know, never stop fighting.
And you had mentioned you wish you had a place like this in Miami. You wish the kids that are still there had this. What was it like growing up in a place that doesn't have this resource?
It wasn't fun, I'll tell you that. You know, it was definitely a lot of rough days, long nights, things like that. But, you know, all I had was family. So to see, like I said, to see what G-Bond is doing and how they're bringing the community together, and how they're helping so many people become more healthy, and like you said, you know, for generations to come, because a lot of these kids, a lot of these adults nowadays, they don't really know about health and how to really go about it. And that trickles down a lot of effects into other kids and their kids and things like that. And I've seen that directly in my own family.
Are there any other questions?
So I just wanted to add a little bit to the conversation in that we talk about social determinants of health, and that's the new buzz. And what that is are barriers to healthcare, which might be transportation, it might be food, it might be exercise. But when we sat down and talked to Pat, you want to raise your hand so everybody can see Pat? And we thought immediately that Zack Moss would be a great partner with our own pediatrician. And Dr. Daniels definitely wants to look at the social determinants of health for children. Because some may not think that kids or little people have barriers to health care, but they do. I was blessed with a mom at home and a grandmother, but how many of these young people nowadays don't have that? How many don't have anyone to give them a hot meal when they come home from school? How many don't have someone on the street corner with them catching their bus? How many don't have anything warm in their bellies? How many don't go to the doctor? How many don't have a pediatrician? Many. So we're hoping that this collaboration, and I need a puffer, we're hoping that this would help by having Zack Moss here, who's he already had me walking up and down the stairs today, so that's why I can't breathe. But he is going to encourage movement, exercise. He's going to encourage community to come out, and not just to see him as the football player, but to see him as a man that is interested and has a heart that wants to share his heart. So we're excited about today. We're excited that this is just the beginning. We're going to all be getting involved, not just community, but staff going to be getting involved. We're going to get Lou exercising. Wow. Dr. Daniel said, wow. But we're looking for this to be a 365. Everyone to get involved, everyone to have an opportunity. No matter if you live in the suburbs, you live in the inner city, we all face the same A to Z's every day. And so we're excited, Zack. We're pleased to have you. And all we can say is let's get ready to, catch a football? Score some touchdowns. Go Bills. Come on, go Bills. Go Bills.